All right, today we're going to talk about something that is incredibly important for anyone who has a cat, works with cats, or just loves them. It's a disease that's really devastating, super contagious, and not too long ago, it was a leading cause of death for cats. We are talking about feline panleukopenia, an invisible threat that every single one of us needs to understand. Okay, let's get right into it.
So, let me just start by asking you a question. If you had to name one of the most widespread, and I mean truly life-threatening diseases for cats, what would come to mind? The answer, well, it might not be what you think, because this is a disease that kind of flies under the radar for a lot of people.
The answer is feline panleukopenia. Now, you might have also heard it called feline distemper, or even, and this is pretty grim, cat plague. Yeah, those names alone should tell you just how serious this thing is. But what exactly are we dealing with here?
So at its core, feline panleukopenia is a viral disease. It's caused by the feline panleukopenia virus, or FPV for short. Now, if that P and V sound familiar, they should. FPV is a type of parvoviruses, and it is very, very close relative of the canine parvovirus that so many dog owners are all too familiar with.
And this is the really scary part. This virus is tough. I mean, unbelievably tough. It's found literally everywhere in the environment. Because it's so common, it's pretty much a given that almost all cats, especially kittens, are going to be exposed to it at some point. It can hitch a ride on shoes, on clothes, on food bowls, you name it.
Just look at this number, 1 year. What does that mean? It means this virus can survive for a year, or even longer, just hanging out on a surface. On a blanket, in a cage, on the floor. It can handle freezing temperatures, regular room temperatures. It's even resistant to a lot of common disinfectants. This incredible resilience is what makes it such a nightmare, especially for places like shelters.
So you have to wonder, who's most in the danger zone here? Well, the risk isn't the same for every cat. The ones we really worry about are young kittens, any cat that isn't vaccinated, and cats that already have a weakened immune system. Pregnant cats are also at high risk, and, this is a big one, any cats living close together, like in an animal shelter or a pet shop. In those places, this thing can spread like wildfire.
So how does this nasty virus actually do its damage? To really get why it's so devastating, we kind of need to look at its game plan, its method of attack. The attack is incredibly fast and methodical. First, the virus gets into the cat's body, usually through the nose or mouth. From there, it goes on a mission. It seeks out and invades any cells in the body that are dividing and growing rapidly. And that makes its prime targets the bone marrow, the body's little factory for blood cells, and the lining of the intestines. By hitting the bone marrow, it basically shuts down the cat's immune system, just wiping out its white blood cells.
And you know, the name itself tells you the whole story. If you break it down, pan means all, leuko refers to white blood cells, and penia means a deficiency or a lack of something. So panleukopenia literally means a deficiency of all types of white blood cells. This leaves the cat totally defenseless.
Okay, so let's move this from the lab to the real world. What does this attack actually look like? And what does it mean for the animal shelters that are fighting this battle every single day?
For anyone with a cat at home, these are the red flags to watch for. You might see a sudden lack of energy, what looks like depression. Then comes the vomiting and really severe, often bloody diarrhea. They can have a high fever, they'll stop eating completely, and they get dehydrated fast. Their belly might be painful to the touch, and their coat can look messy and unkempt. And in kittens, you might even see some neurological signs like being wobbly or having tremors. If you see these signs, don't wait, it's an emergency.
Now, as tough as that is for a pet owner, imagine that challenge multiplied by 100 in a shelter. One source just nails it when they say panleukopenia is a major problem for shelters because it's so contagious and the virus is so tough. In a place with lots of animals, one sick cat can turn into a full-blown, devastating outbreak in no time.
So how do shelters fight back? I mean, it's an all-out war. For every challenge the virus presents, they have a countermove. It's highly contagious, they use strict quarantine protocols. The virus is tough and lives on surfaces. They use rigorous cleaning schedules with bleach solutions, one of the only things that reliably kills it. To stop the spread, they vaccinate every single cat as soon as they come in. They use disposable litter pans, and they have strict rules for staff about wearing gloves and washing hands to keep from spreading it themselves.
So, what happens when a vet suspects a cat has panleukopenia? Let's walk through the difficult path of getting a diagnosis, treatment, and hopefully making it to recovery.
A vet will usually have a strong suspicion based on the symptoms we just talked about. But the confirmation, the smoking gun, usually comes from a blood test. And what are they looking for? A severely low white blood cell count.
That's the classic calling card of this disease.
And this, right here, is maybe the most important thing to get about treatment. There is no magic pill. There's no specific drug that kills this virus. So the fight isn't about attacking the virus head-on. It's about keeping the cat alive long enough for its own body to rally and fight back.
Survival comes down to one thing: intensive supportive care. This is round-the-clock work. We're talking IV fluids to fight off that life-threatening dehydration. We're talking medications to try and control the vomiting and diarrhea. And antibiotics, not for the virus, but for all the secondary bacterial infections that are bound to pop up when the immune system has been knocked out. It's constant nursing care, nutritional support, keeping them warm, all while they're in complete isolation.
The outcome really is a tale of two very different possibilities. On one hand, if you catch it early and you are super aggressive with treatment, the prognosis can actually be good. Many cats pull through, and the silver lining is they get lifelong immunity. But for cats that are already really weak, with a low body temperature and bad secondary infections, the prognosis is unfortunately very poor. Timing is everything.
And that brings us to the best part of this whole story, the most hopeful part. Given how hard this disease is to treat, our number one weapon, without a doubt, is prevention.
Let's just put this as plainly as possible. Since there is no cure, preventing this disease with a vaccine is absolutely vital. It is the single most effective tool we have in our arsenal to protect cats from Panleukopenia, full stop. And the good news is, there's a well-established schedule for this. Kittens should start their vaccines around 6 to 8 weeks old. Then they get boosters every few weeks until they're about 4 or 5 months old. That's to make sure they build a really strong immunity as the protection from their mom's milk starts to fade. After that, they just need regular boosters as an adult.
And I know what you might be thinking, but my cat lives indoors. Does he really need this? And the answer is 1,000% yes. This is what's called a core vaccine. That means it is recommended for all cats, no exceptions. Remember how tough this virus is? You could track it into your house on your shoes, so even indoor cats are at risk.
Look, it really all comes down to this one simple idea. Vaccination is our shield. It is the best, most powerful way we have to give our cats life-saving immunity against this horrible disease. It's safe, it's effective, and it saves lives.
And that brings us to one last thought. It's great that we can vaccinate and protect the cats in our homes, but what about all those millions of vulnerable cats in shelters and out on the streets? How can we, as a community of animal lovers, help extend that shield of protection to them? That's really something worth thinking about.